This segment is sponsored by Advanced Medical GI. The experts at Advanced Medical GI have the latest innovations to help you kickstart and maintain your weight loss journey. Joining me now with more all about this is Chief Medical Officer Dr. Richard Allen Blosser. Dr. Blosser, thanks for being with us again.
Thank you so much for having me. It's a joy. Good to see you again as well.
Always love talking to you, but I have a question for you because you're here under Advanced Medical GI instead of what we've always said before, Endoscopic Wellness Center of America. Is this a new business that you're starting?
Yeah, it's the Advanced Medical GI has been around for 3 years now. It's not a new business, but we incorporated the Endoscopic Wellness Center, Weight Loss Center into Advanced Medical GI for business reasons, but also for patient care reasons, so that we could expand our offerings and expand patient care even beyond what we did.
I know there's so many weight loss options out there for people. Now we talk a lot about medication, injectables. Why would someone maybe opt for a procedure?
Well, the first is that the whole premise of the procedures is to make the gastric volume smaller. So whether we take the surgical options or where we do what we do with the endobariatric options, the ESGs and the balloons, they all start with the premise that you're making the gastric volume smaller. The problem, one of the problems, not including the fact of monitoring and that in starting the injectables, is that once you start them, you're on them for life. It's not something you can take for a month and lose 10, 15 pounds and stop, not including the potential side effects and side effects that are serious and are coming to light both in the medical press as well as in the lay press, whether it be pancreatitis, kidney failure, or even death, are not only reportable but well documented. These drugs need to be monitored by a physician with routine labs and routine follow-up. It's not something that you can just take on your own without potential side effects.
I know you have a bunch of endobariatric procedures. What do you offer?
Well, we start off, the least invasive is the balloon. So we have two types of balloon. We have the Orbera balloon and we have the Spatz balloon, one being adjustable, being Spatz. And these occupy space in your stomach and they afford you the opportunity to lose somewhere in excess of 25, 30, 40 pounds. We have had patients lose hundreds of pounds with the balloons. But these are temporary. They're in for 6 to 9 months, no longer than a year. And simple endoscopy done with an anesthesiologist sedating you with a simple upper endoscopy. The ESG, which is the more permanent endoscopic sleeve, has really taken off and is replacing the laparoscopic sleeve for many different reasons. This is an endoscopic procedure done in our ambulatory surgery center that takes about a half hour. There's no cutting, there's no antibiotics, there's no pain medication. You don't run the risk of surgery. The complications from surgical intervention for weight loss are well documented. With mortality rates as high as 1%. So we don't talk about mortality rates, and our complication and potential complication rates are usually less than 1 in 5,000. So it's very safe, it's very effective. The TOR procedures, and especially the TOR-B procedure, which I invented, is a way to readjust patients who've had previous either TOR laparoscopic sleeves or Roux-en-Y gastric bypasses, and we can take them back to where they were their original day of surgery with a simple 15 or 20-minute procedure in the office. So really cutting edge endoscopy and endobariatric procedures that are much more cost effective, much more enduring, and more importantly, much safer.
A lot of options to consider. Dr. Blosser, great to see you again. And for more information or to request a consultation or an appointment with Advanced Medical GI, you can call 833-453-9522.